Hello everyone. In today's video, I'm going to show you exactly what you need in order to perform your own intramuscular injection and how to prepare it. Now, this is a typical setup that is used for intramuscular injections for testosterone replacement therapy. And the most common injection sites are usually the deltoid, the gluteal muscle, or the quad. Now, this setup is a typical one used generally for those injections, but it can vary, according to different doctors' instructions or according to the procedure that you're going to do if it's not for testosterone replacement therapy. That being said, always work with your doctor when performing your own self-injections. I'm not a doctor, I'm just doing this video for educational purposes. So with that being said, let's get to it. Okay. So to start off, let's have a look at the equipment that you're going to need, right? Firstly, you're going to need your vial or your ampoule of testosterone produced by a legal lab and as supplied to you by your pharmacy or doctor for your prescription. In this case, I am using the Syringe 250 milligram 1 ampoule by Aspen. Next, up over here, you've got the 25 gauge 1-inch needle, which is going to be used for injecting. That's usually got an orange cap. Below that, I've got the 18 gauge 1.5-inch needle, and this is optional. This is sometimes used for drawing up the testosterone before you inject. You use this needle to draw and then that needle to inject. Just because it's thicker, it draws the testosterone more easily, but it's optional. You don't have to use it. You can use a normal needle. It's just going to be a little bit harder. Next, we've got the 1 ml Lear syringe, and then below that the 2 alcohol swabs, and finally we've got this guy over here, which is a yellow sharp spin, and that's used for disposing your needles and your sharp items. So I'm going to do a close-up quickly just so that you can have a closer look. I'll zoom in so you can see everything that we have here and maybe the names and the info on it, and then we'll move along. Right. In the next step, we're going to prepare for the injection. So, to start off with, make sure your hands are washed and clean. Then, open and attach the large needle to the syringe. This is going to be used for drawing the testosterone. In our case, it's the pink needle, but it could be any needle that you decide to use. Next, we're going to draw the testosterone from the ampoule or the vial, depending on what you use. In my case, I've got an ampoule, which is already open. If you struggle to open your ampoule, just check my channel. I've got a video to show you how exactly to do this. Also, if you don't know how to draw from a vial, there's a little bit of a technique to it. Check my channel for that too. Right. Now that we've drawn the testosterone, we're going to remove the air from the syringe if there is any. In my case, you can see there's a nice fat bubble that got in just because I'm a little bit distracted as I'm creating this video, but we're going to make it get to the top and then squeeze it out. Next, what you want to do is swap needles. So you remove the pink needle, whichever needle it was you used to draw, and then you attach the needle that you're going to use for injecting. In this case, it's the orange 25 gauge needle. Again, if you attach the new needle, the one you're going to use for injecting, and you notice there might still be a little bit of air in the syringe or in the sort of area between the syringe and the needle, then just squeeze it out like you did before. Finally, open up your alcohol swabs and have them ready so that you can clean the injection site when you inject. Right, that's it. Now we're ready to inject. And that's it. I hope that cleared up any questions you have regarding the preparation of your injections. So if it did, please just click the like button and let me know if I missed anything that you think should be here in the comment section below, and I'll see you next time.